Welcome to What Brought You Here Today, an interview-style mental health podcast that focuses on real experiences and how we navigate and move through them. The guests on this show provide personal and professional insight at times and come from all walks of life. Not all of the guests work in the mental health field, and they've all chosen to be brave and vulnerable while sharing parts of their story with you. Please keep your own mental health and well-being in mind while listening. The topics in this episode are sensitive. If you experience any distress while listening, please pause and return at a later time. Please take care while listening. Hello, everybody. Welcome to What Brought You Here Today, Season 4. I am excited to be joined today by Michelle, who is a licensed social worker, and we are going to be talking about pregnancy loss and miscarriage today. So a heads up for those of you who are listening to make sure that you take care while listening. And if you'd like to move on to the next episode because of this topic, you are always more than welcome to come back to it when you are ready. So welcome, Michelle. Thank you for joining me.
Thanks for having me. I'm excited to be here.
Yeah, of course. I will let you introduce yourself and tell the listeners a little bit about who you are, what your practice is like, and anything else that you want to share with them.
Great. So I am a therapist. You mentioned that I'm a clinical therapist. I've been in the field for about 14-ish years. When you start hitting double digits, you just stop counting because it stops being something to brag about. And you start questioning, how did it get that far? Recently have transitioned from community mental health services into private practice. I founded a private practice, Path Forward Counseling, and that is my space to be able to draw on lots of different areas of expertise from being in the field. And it has also been a place for me to be able to pursue some passion areas. And one of those is supporting moms, dads, but also family members around pregnancy loss. My husband and I have experienced at least 5. And if you know some of the stats around miscarriage, there are some that are just kind of ambiguous because it could be, couldn't be, but you know your body and so things feel like it. And so at least 5 miscarriages. And that journey has been one that has brought pain, but also one of the things that's redemptive about it for me and my story is that it's also been something that has driven passion for coming alongside others. And it has been something that I've woven into the nature of my private practice. And so I work with a lot of primarily women because it often is more socially aligned for women to seek support after a miscarriage. And yet there are far more people that have experienced that loss and just the sense of trauma to the body than those that actually receive care. And so hopefully being in a place to be able to share a little bit about what that journey has looked like for me, both on the personal side as well as how I engage with it professionally, will also open doors to some of the silent wounds that others have experienced. So I'm excited to be here and share with you.
Thank you for sharing that about yourself. And I want to also be mindful that this is like kind of on a public platform. So I want you to, feel comfortable sharing what you're comfortable sharing. But can you talk a little bit more about the stats of pregnancy loss and miscarriage?
Yeah, absolutely. Statistics range in terms of depending on what study, but generally speaking, there is somewhere between a third and a fourth of all pregnancies. So that captures folks that maybe had a pregnancy and the fertile egg was passed even within and maybe you were only like a day off of your cycle or potentially even the same day as your cycle. So that piece of it, not everyone is aware of. And that's one of the things that makes pregnancy loss tracking really difficult, as well as the stigma. So somewhere between a third of pregnancies and a quarter of pregnancies, the body says no, essentially. Miscarriage loss can happen anywhere from those earliest points of fertilized egg up until stillbirth. So that would be even in like the final moments of pregnancy. And then we think about also like those postpartum losses that maybe occur during those really early weeks. And sometimes that's expected and sometimes it's not. For that whole, even in the 4th trimester, we might say. Miscarriage loss is most common in the 1st trimester. So up until 12 weeks is statistically the highest point of miscarriage. And some of the things that we think about are in that period, progesterone production and some of just the body's like hormonal responses to, I always referred to it, and I don't know if this is something other people have used or if it's something I just grabbed hold of, but the idea of keeping baby sticky, because at a certain point, the hormones or the things that would keep baby in the womb shift over. And as baby grows, then it's also harder to have it pass for those reasons, right? But most pregnancies that result in loss will happen in that early phase, and a lot of the whys around it are still somewhat mysterious, because for losses that are miscarried naturally, it actually might feel kind of like a period flow, and you don't necessarily have tissue to explore. So there's a lot of mysteries around the why. The percentages around miscarriage loss will slowly decline up until the later stages of pregnancy, but most common in those earliest phases. And we think about some of the ways that DNA, if there's an extra chromosome, or, and I won't get too sciencey, one, because I'm not very sciencey, but also when we try to understand the whys, so often we're thinking more along the why me rather than the why science, right? And so we think about some of the chromosomal pieces. If the body knows that fertilized egg isn't likely to fully develop, the body actually has some natural ability to say, nope, this isn't going to bring about joy in that fourth trimester, and will pass naturally. And so there's some things that mechanically those chromosomal pieces might actually not bring about life in the sense of like duplicating cells. And I think sometimes, and this is layman's terms, the body also kind of has that sense. And so some of those are just, it's not quite right. So the body will pass it naturally. And then there's times where the body doesn't pass it naturally and it's still hanging out there, and the hormones start to adapt to not being pregnant anymore. And sometimes that requires some assistance then from medical professionals to kind of right the body, to clear out some of that tissue and allow the body to get back to being in a place to pursue pregnancy in the future.
Are there any statistics around multiple miscarriages, multiple losses, and, like kind of what that looks like, or if certain individuals who can carry babies, you know, get pregnant are like more likely to have multiple miscarriages?
Absolutely. Absolutely. So one of the things that I will say is there is a really cruel 1% club, and I'm in it. There is very, very low likelihood of subsequent losses. When we think about that norm of 1 in 3, 1 in 4, more often than not, the body did its natural thing, and the subsequent pregnancy will be normal. For most folks, an experience of miscarriage doesn't predict subsequent miscarriages. It is actually very, very low likelihood. And so that piece of 2 in a row is actually about a 1% chance. It is a very low possibility. Now, there are things that can complicate that and maybe have you at a higher risk. And that can involve different things related to health pieces, related to if there are excess production of tissue where the uterus itself is maybe. Recently just watched Grey's Anatomy, and I can't get the thought of the phrase that she uses of hostile uterus. I can't get that out of my head, and so
Yeah,
that's the one I'm going to
sure.
use. Yes.
Great.
Yes. So terrible phrase, and yet it's just plaguing me right now. But we think about, there are going to be medical conditions that might have somebody at a slightly higher
Sure.
likelihood, and age can be a factor in that as well. As the body ages, some of the natural ability for the body to produce a healthy fertilized egg is also at slightly higher risk. And we think about that also is true in the risk of Down syndrome increases with age. And that is that same concept of the genome of the egg is slightly altered. And so we think about that increased likelihood of Down syndrome is also going to be parallel for those that the body says, we're not going to continue to sustain this pregnancy because it's not considered a healthy egg, right? So those would be parallel. So I don't know the specific stats about it, but I would say that they're going to be comparable in, as age increases, then so does some of the risk around miscarriage.
So when you're, women are coming to you, people who've had miscarriages, and maybe even for yourself too, if you're wanting to share and be open about it, what kind of impacts on mental health are you seeing?
Absolutely. One of the things about miscarriage loss is that when we experience grief of any sort, some of our natural tendencies around anxiety, depression can be heightened. Grief can compound, right? If we haven't seen if we haven't seen healthy examples of grief, for example, then it's going to be harder for us to bring healthy grieving to this, particularly given the fact that so often it's silent. It's not necessarily something that society talks about a lot. I would say that there's been some improvement in more openness, more integration in media, where we're seeing examples of loss woven into development. And yet it is still highly stigmatized. The number of people who experience a loss and their support systems don't know about it is really high. And so somebody who's maybe already more prone to depression might experience more depression at a heightened degree because they have this silent hurt that folks in their life aren't able to show up for, and that can add to a sense of loneliness. For folks who have already experienced quite a bit of anxiety in their history, they feel all that much more anxious about wanting to track fertility and trying to kind of control some of the process of what getting pregnant again might look like. Attachment related concerns can become so big when we're thinking about the relationships that are so intimate, even with our own bodies. I do somatic work, and so some of the somatic work is just recognizing that my body just did something I'm not okay with. You are working against my goals, body. And so like the thought of like, how do we get reconnected with our sense of self? And that's not even including the fact that partners are going to grieve differently. For some, it's easier to just kind of contain that and move forward and just be optimistic about what's going to come, or to be able to experience joy in everyday things. And for some, that might be experienced as not caring, not remembering, not being able to show up for your partner. So we think about like the incompatibilities of how we grieve. Two people who come from different lived experiences around how you grieve are also going to experience that loss differently. How much people want to share might be not compatible, and recognizing that a disclosure for one is a disclosure for both. Sometimes the work that I'm doing with folks is just being able to work on what is a reasonable compromise. How do you grieve together in a way that honors both of the partner's needs? Or working with an individual on like, how do we reconnect with our sense of joy? How do we reconnect with a sense of trust in the process? How do we kind of relinquish some control over the things that we don't have control over? Or how do we ride the waves of what is? So a lot of it, I would say, is not it's not exclusive to the miscarriage itself when we're thinking about what it does that look like to bring it into a therapy space, but recognizing that the loss itself is going to add to a picture that probably was already there.
From the somatic standpoint, if someone's listening, maybe has gone through this journey or is maybe in the throes of a loss, is there anything tangible that a listener could do to help get back in touch with their body? Or maybe not feel like the disappointment or like the hate towards their body for what's happening?
Yeah. One of the things that I would say is interesting about miscarriage loss in how it distinguishes from a loss of a parent or a sibling, something to that effect, is that you get this monthly reminder, particularly if you're the female partner, and the sensations attached to a period are almost exactly the same depending on where in the development of the fetus you were. So we think about the primarily losses are happening between 0 and 12 weeks, and up to about 8 weeks your body can actually discharge naturally, and it will feel like a really heavy period because the tissues are going to be small enough to pass naturally. And so for those that have had their loss happen in that similar way, you get a monthly reminder. And so it's not uncommon to be triggered by that. And then your hormones are raging. So you also have the beautiful joy of, just how pleasant we all are when we're in that part of our cycle anyways. So we think about some of the somatic work that I do is actually just being with the body of being able to connect with here's what's happening. And if we actually can tune into here's what's happening, I'm not miscarrying right now. Right now, I'm experiencing the mechanics that allow me to carry. And that can be helpful for somebody in a place where they're experiencing that echo of loss. One of the things that we think about too is being really planful of for clients, and I'll use the sex word because I talk about sex a lot in my sessions as well, because it's part of how we are. And it's the same body parts, if you will, that experienced that loss that much more intimately. For some, having sex during their period might have an ick factor, and yet it can be really responsive to, like, this is the most painful part of my month. And how do we allow those organs to also be part of bringing joy in those triggers, right? So we think about if there's ways to integrate even reconnecting with what those organs do in a really helpful, productive place. For those that have carried successfully, sometimes it's allowing them permission to have some of that somatic work be just like imagining in those difficult moments what some of the joys of pregnancy were at other times in their story. For some, it is also just being able to find resource in their body of like, you know what, my uterus really sucks right now, but my toes feel really good. Or I can use my hands as kind of a resource, and I can let them sit on that part of my body. And it's kind of like, we think about a hot pack can be really comforting for period cramps. You can do the same and just allow yourself to just experience that, you know, it's not a 10 right now. It's actually just a 9. Or, you know, even if as I allow myself to enjoy that heat and I just kind of tune in mindfully to what that heat is offering my body, it feels a little bit more like an 8. Or just being able to find some resource in small ways. And that can even be having that intimacy builder between you and your partner of like maybe planfully having a massage date during your period where you're attending to really kindly, gently loving on your body at a time where that, like, man, body, I really hate you right now. Because some of us have that thought even when we're not miscarrying, right? Or when it's not echoed by loss. There is that already kind of like, why do I have to do this every month? And it just compounds, right?
Yeah.
I'm sure many can relate to that feeling. But
Yes.
how do we then respond to that? Like, oh, it's a little bit harder today, with care and compassion. Jobs during that time can be about relaxing the system and just enjoying, like, hey, you know what? It's not completely gone. But if I could just tune into where the waterline changes my sense of heat and like awareness of, you know, if I'm down here, the water's right here, I can kind of notice that it's just a little bit warmer beneath the water. Somatic work is really just about attending to what's there and not hyper focusing on the parts that feel icky, but actually being able to resource the parts of our body that we feel connected to. And that can be, we can also achieve that through like doing a workout, and you feel and you really tune into the muscle groups that are being utilized in that moment. And like a nice slow yoga or a nice slow strength training can do really nice things for bringing attention to muscles that are not feeling the sensations around the emotional trigger of loss. And so that would be another piece. Is it's also really good for your body just in general. It can be cathartic in some ways to slam a weighted ball on the ground. And so there's lots of ways that can be beneficial to the system. But it allows attending to parts of the body that maybe aren't as triggering and give space to those that are more triggering to kind of settle a little bit.
Okay. I love that. I think also you mentioned like having compassion, and, you know, I work a lot with women and, you know, moms in particular who have a really hard time with self-compassion and just like being gentle with themselves. And I imagine it is extremely hard during a loss to have that for
Absolutely.
yourself.
Yeah. And I would add one
And
of the
even for
things
your
that
body when this is like what we're supposed to do.
Yes. And it is. And it's one of the things that, because we have more technology, we have far more access to that information as well. We think about like 100 years ago, before the clear blue strips or the early pregnancy detection, we'd be far less aware of a pregnancy. It would just come, and then well, at some point I start to notice that I'm pregnant, and then and it is sustained or not. Today, we have so many early detection things, which is great and wonderful for the planners of the world, me, and also means that we all of a sudden become burdened with more awareness and attunement. That's not bad, but it can be experienced as extra hard, if that makes sense. Back in the
Yeah,
day, it would just
definitely.
be like, oh, I must have miscalculated on my calendar that I don't have on the wall, right?
Right. Right. Now
Yeah.
we've got all the trackers and all the different strips, and all the
Yes.
tests that you can take. So
Yes.
yeah, it feels like, the pros and cons to technology as usual.
Yes, absolutely. And it's outpacing our ability to really do a lot of planning around, well, how do we mitigate that part of the risk, right? Absolutely.
I think this is something that's going to obviously vary by individual, but for people who are wanting to try again after a loss, how do you, as maybe like the therapist or the kind of professional in the room, help them decide like when to maybe
When
start
that returns.
moving towards that path?
Yeah, absolutely. Well, one thing I would say is that there's not a right or wrong. There's going to be increased anxiety around and maybe a more difficult attachment to pregnancy because of your lived experience. We think about that you have a hard breakup, you're maybe more hesitant in your next relationship. That's reality. This is a breakup that was came by surprise, right? Um and so there is to be expected. And I think that the question is less about, is there a right or wrong day? And what does it look like to feel prepared for what that will bring? When I'm working with clients, a lot of it is there agreement between the partners on readiness? If there's not, you're not ready. Some of it is managing some of the like compulsive energy of given that some that maybe have a higher propensity for anxiety might do a lot of tracking, and that actually might feed a sense of like overwhelm from their system. And so being in a place of, what if you only tracked every other month, is sometimes they ask. What if your partner was actually the one that initiated and it gave you some permission to just be on the receiving end of sex rather than trying to control the process? For folks that are feeling disconnected and sex doesn't have the freedom to just be sex, it's exclusively about reproduction, then that's usually an invitation to say, what if you took this month off and you just found some space for each other to have sex for fun again? I think it's very wrapped up in what somebody's presenting with, in the sense of how that miscarriage kind of shook your current way of functioning in the world. What I would say is there's timetables that you'll get from the doctor around, depending on what procedure you had to have. If you discharged naturally, then usually it's that like right after the next cycle, you can try again. For others, if you had to have a procedure, then it might be asking you to wait 6 weeks. So we really think about that span of time is going to be different on the medical side of things. And so I recommend people consult their professionals, but that's the least restrictive date. If you aren't emotionally ready for a year, great. Focus on the pieces of healing that you need to focus on. If you're in a spot where it feels ready to go and you both are in a place of like, yeah, like this is where it's at, we're just going to let it kind of roll. And I would say each individual is going to have that look different for them as well. My first loss, I happen to have uh, already have done some like just psychoeducation around, or have received some psychoeducation around miscarriage loss, because I was facilitating something with an outside speaker for a group of clients that I was working with. And so it wasn't even about my own experience at the time, but I was blessed by having that in my back pocket. So I knew it wasn't about me. It wasn't something I had done wrong. And so we were in a place where we had a cycle, and then ended up pregnant the next cycle. So we were in a spot that happened really, really quickly. And I would say there was advantages and disadvantages.
Sure.
Disadvantage, it was really hard emotionally because there wasn't a lot of healing that happened from that first loss. There was things that I didn't recognize that had been impacting me that were showing up in the subsequent pregnancy and then the subsequent loss. And so we think about there was risks there in that sense. Any pregnancy you're pursuing, even if it's outside of loss, is risky because they come in, they infiltrate, and then your whole life is a little bit up in the air. Children are blessings and they bring challenges. So that piece doesn't go away. And at the same time, not having had as much time to process was helpful in some ways. So there wasn't a right or wrong in reflecting on some of our time. One of our other losses, we chose to wait a much longer period of time. We waited and actively prevented for, I think it was closer to like 6 months before trying again. And then ultimately we got to a place where we made the decision that it was too much to continue to have that risk. And it was easier for us to risk the grieving process and accepting that we were no longer pursuing biological children. And that was hard as well. To right or wrong in that timeline, I think it just was, it feels right, and you might find yourself it feels right, and then you change your mind the next cycle. I would say in terms of some things for just folks to look for is give yourself at least one period cycle and emotionally take a check-in of how you feel during that period. Recognizing that it is an echo of loss, it's going to give you a good indication of if I start trying, how am I going to feel about a no from my body? How am I going to process that no? And being able to like hold that. If you're in a spot where it still feels really triggering to go to a baby shower or to see announcements on Facebook, that's not uncommon. If it feels like you can't function when those things happen, if it feels very crippling, then I would encourage doing some work with that before pursuing trying, because we think about the body is naturally going to follow that cycle, whether you're trying or not, in the sense of ovulation and then discharging the eggs as they're no longer able to be fertilized, right? That can be a good indication of like, where am I actually at in my grief cycle? Is it really overwhelming to my system, to my body, to my relationship when that happens? And that's going to be a good kind of checkpoint in the relationship. The other like helpful piece of just kind of checking in is there anything that I'm telling myself about why I can't wait? We think about when that cycle happens, it can be depressive, and so we have a hard time moving forward. But it can also be more in that like it overexcites it. Oh, like let's make it happen now. If there's anything that's telling me I can't wait, and sometimes we get that message from the medical professionals as well of like, well, you're borderline geriatric now at 35. So you better get to it. If we think about what's going to make for the healthiest family system, that also is going to include taking time to heal before we ask our body to do a really hard thing. And pregnancy is a really hard thing. And we think about, we wouldn't ask somebody to do a surgery one day and then the next another major surgery. In the medical world, there is required time to give the body the ability to heal naturally on its own and kind of get enough recovery to be able to attend to the next part of our body. And the same can be true of how we think about how do we allow the wound of loss to heal before we ask it to do another big thing. And so I think that is going to look different for everybody. And it's not about measuring like, well, if your loss was only 6 weeks in, it was kind of minor, so you could get back to it faster. It might actually be easier for somebody who had 2 hours with their child after a stillbirth to just be able to hold that real I don't want to say baby, that's not the word I'm looking for, but that like tangible time together. It actually might feel easier for some who have experienced stillbirth to try earlier than somebody who experienced a stillbirth at six weeks and has nothing to prove it. So we think about that measure isn't about time. It's more about your sense of peace in that loss. And we would say the same to be true of, if you lose somebody really significant in your life, facing that person, you can never replace that person. It's how quickly do I feel ready to risk what that relationship might bring me in the emotional upheaval of attaching. Because that is the challenge that we're asking somebody to take on.
Yeah, definitely. And I think you touched on something too that I was thinking about, of like how do you help someone through appropriately grieving for themselves when society and the system is like, your biological clock is ticking.
Yes.
Like,
Yes.
and who feels that pressure of like, I'm 35, 36, 37, 38, 39. Like, if I don't do this now, I'm never going to do it.
Yeah.
That's like
And we think
and I think that's
realistically, the
hard in
healing
general.
time is going to happen at some point. If you jump right into trying again and you end up having a pregnancy, it might show up in that it's really hard after birth to attach to that baby. And so you might be doing that work concurrently with trying to nurse or concurrently with trying to celebrate a first birthday. Or we think about, and some actually are going through that loss concurrent with pregnancy because sometimes you lose a twin. So recognizing also that group of folks that might have lost a twin and they're celebrating these milestones of first birthday, second birthday, and that's also the due date for the child that they lost. So also to just kind of capture that part of miscarriage in there. But yes, absolutely. There is so many pressures. And we think about how many pieces of society's interactions are wrapped up in children. We have one daughter, and the number of times that you're talking with a complete stranger who asks you, "Are you planning to have siblings or just one?" And when you think about the echoes of hard loss, yes, just one is not by choice, or some of do you want me to trauma dump on you? Finding a good balance to that. I usually will tell clients, if somebody asks you an uncomfortable question, then they need to be prepared for an uncomfortable answer. And if they're not, that's on them to hold. So now if somebody asks me, then I will usually tell them, we've had several losses. And so unfortunately, this is our family makeup right now. And then period end. Then they have to deal with that question. If that made them uncomfortable, then they shouldn't ask that question. They shouldn't just want a complete stranger when you don't know their story. So even just being thoughtful about how do we make space for our truth in a society that doesn't naturally do that doesn't give a lot of space for the trauma that is pregnancy loss. The fact that our society waits, it is almost systematic now that we wait until like 8 to 12 weeks to announce. And then if you had a miscarriage between that window, then you're burdened with the decision of, do I share or do I not share? Do I make other people uncomfortable with my story? When realistically, it should far more focus on, is it helpful for you for others to know? Is it helpful for you to be able to name this as an experience that you had so that people can lovingly come around you? And we don't tend to prioritize that as a society. And yet it's woven into even pregnancies for folks that are with healthy fetal development. It's interwoven into how we announce something like that. And so we think about for somebody who has a cancer diagnosis or they have a biopsy because they aren't sure about cancerous or non-cancerous. Very seldom do people just never reference that again. It's asked about at every single medical appointment that follows, right? And we don't do the same with pregnancy. Even interwoven in the system, I remember kind of asking a lot of the questions about what happens now. When we had our first loss, we had a terrible experience with the clinic. We had our second loss, and then we ended up seeking a different provider because they didn't even call me to schedule my hormone test. And so there was just there's things that the system doesn't tend to respond to miscarriage until there's 3, because at 3, then there tends to be more concern about something happening either on the male partner or the female partner side. And so we think about, if society's medical system doesn't legitimize miscarriage loss until 3, we're going to think there's a ton of trauma before we hit 3. There are procedures that aren't offered or are not insured, not covered by insurance. I remember we had a later stage loss and had to kind of make a decision around $1,000 assessment of the fetus to be able to pathology, to see what was happening in that loss, to see if it potentially was something that was happening in other losses. And you're laying there on the table, they're about to put you out for the procedure, and you're like, well, I don't really know if we want that information. And it's just kind of some of the unintended not consequences, I should say, the unintended experiences of impact because society has not normalized this. One other tidbit that is horrifying to me, that isn't related to your question, but I'll add it in here, is that the billing code used for miscarriage is actually the same exact billing code that they use for abortion. How horrifying is that? That as a system, I remember they didn't tell me that in the procedure. They didn't inform me of that. I got the bill and it said abortion in the code. I can't remember the exact billing code, but it includes that word. It felt very invalidating as somebody who is experiencing a loss to have that projected. And certainly that's not intended to be any remark about those that have chosen abortion for whatever reason. It's not a political statement, but really that captures an unintended impact that hasn't been remedied in society and is really a cruelty to those that are already experiencing hardship and loss.
Yeah, I mean, I think I didn't even put the billing code thing together. I had a very traumatic pregnancy and then a subsequent emergency surgery 3 weeks postpartum for retained pregnancy tissue. And had that, and didn't even think that I just read the EOB and was like, whatever.
Yeah,
Also,
yeah,
having a
yeah.
baby in 2020 was like a mess to begin with. But I think, like, if it's like
So
a whole
true.
nother episode of how, like, I also have a lot of friends who are OBs who I adore, but like the medical system in general doesn't do a good job of setting us up for success with loss and even like traumatic births or like postpartum, which again could be a whole nother episode because,
Yes,
like I was never
absolutely.
even referred. I should have been referred to therapy at 3 weeks postpartum after I was, failing to breastfeed and enduring an emergency surgery and readmittance to the hospital.
Yeah.
But they're just like, go home and raise your baby.
Yes. Well, and I'll echo that piece of you asked about the somatic piece and things that people can just be attentive to
Yeah.
is miscarriage history is a factor that they recognize as being one that impacts attachment to future children, and that shows up in lactation. So one of the things that can be a risk factor for having difficulty breastfeeding a future child is actually having a miscarriage history. It's also related to postpartum anxiety and depression. There's a correlation because the actual pregnancy is no longer as innocently like what's this glow that people talk about with pregnancy, because I feel like I have very like different experiences of
And
pregnancy
shit's made up.
because mine was riddled with different anxieties of like I don't want to attach too much and have it be too hard to say, like that it didn't work. Some of the pieces for folks to, if that's part of their history, tell your medical system, because what might be like relative normal for somebody who has not experienced loss or doesn't have these risk factors might actually be a sign that your body is experiencing those postpartum depression symptoms. Or when we think about attaching to nurse, there's a hormonal component to that, but there's also an attachment component to that. And it is a very intimate relationship with your child. And so it's not unusual that can weave itself in really uncomfortable ways. Somatic work can do great things with nursing. I actually will invite clients that if they are in the process of nursing and they bring their baby, they're welcome to nurse in my space, because sometimes it shows up in their face of like, this is so terrible. And that sometimes is about like, hey, I'm sitting in front of a somewhat relative stranger and nursing.
Yeah.
But it might also be about like the attachment experience. And so being able to
Yeah.
do some of that somatic work while they're in the process of nursing can actually be a beautiful thing. And if your therapist is ever uncomfortable with you nursing, you just let them know that there was a therapist once that told them that they should do some work while you're nursing.
Yes. I have had plenty of women bring nurse in my office and just work through it as we need to.
Yeah.
And I think it's, it also can be like kind of a freeing experience, like a exposure related experience, right? We're just going to do this
Absolutely.
right here,
Yep.
right now. And in a different way that like lactation consultants or, other professionals do,
Yes.
they touch more on maybe like the physical aspects versus like the mental and emotional
Yeah.
pieces of it, which is great.
Completely.
So I want to be mindful of our time. I know you have some resources to mention, so why don't you shout those out, and I will also put them in the notes for this episode. But where can people find more information? Where can they find you?
Yeah. So I'll be sharing a little flyer that I have put together around resources, and some of those are more national. One of the things that we didn't talk a ton about is men who have experienced miscarriage, because it tends to be easier for the partner not experiencing the physical loss to kind of rally to care for the physical needs of mom. And so I don't want them to feel lost in that. If you are in a spot where you had a medical procedure for the loss, it's more likely that you're able to seek care within the hospital system. And so those are great for in-person meetings, and being able to connect with folks locally that maybe are going to have some shared lived experience. There are also a lot of virtual options. One of the things about COVID, you mentioned COVID earlier, and we think about, oh, it was terrible. And yet it also has brought a lot of opportunity for support groups that are happening virtually. The offerings have just kind of exploded. One of the places that you can find like local groups or virtual platforms is at PSI. It's Postpartum Supports International, and that is their bread and butter. Is they want to make sure folks that are experiencing across the spectrum. And so this would also be a place to go if you are post-loss and pregnant, if you're experiencing postpartum depression, anxiety, the whole gamut there. There are men's specific groups, there's couples groups, there are a lot of different resources. And so that's probably the biggest one that I would recommend. And there will be some others in that list as well. There's some that are for BIPOC individuals. Specifically, there's others for, I know that they offer programming in Spanish as well, which is great. I don't know how many other languages, but because I'm bilingual and I work with clients in Spanish, I do pay attention to those things. But they have a lot of different offerings for different groupings as well. And I know that they have tended to be really responsive if somebody's looking for something, to see if they have resources to also add that. And each state has its own chapter as well. And so that can be a great resource for folks. The other thing is there's actually several different groups on Facebook. And if you just type in like pregnancy after loss or miscarriage, it's amazing how many resources there are out there, and recognizing that each of those groups is going to be facilitated by, sometimes it's folks that are in a place of bitterness around their own loss. Sometimes they're folks that are in a helping profession and have some like professional experience. Posting in those groups can be in it like really healing places, and sometimes they're not. And the admin is then kind of cultivating the culture of that group. So I let folks know with a grain of salt, Facebook groups can be great in that they're readily available. And you can kind of like throw it out there and get feedback in positive ways, of like, oh man, this experience just took place, and what do I do with that? So some of those really tangible things can be really great.
I always
And
tell everyone,
also,
proceed with caution.
yes, exactly.
Treat
Proceed with caution.
every Facebook group like it has yellow caution tape up, especially
Yes,
if you're a mom
exactly.
or a parent. Just proceed with
So
caution.
very true. So very true. And then the other piece is recognizing you will know best the threshold of like, what's your relative normal? Am I going through a hard time and I feel capable of managing those challenges as they come, or do I need professional help? And so I am a therapist, and this is an area of passion. This is an area that I wrap around in my practice. I'm located in Plymouth, Minnesota, but also can meet with folks virtually. So you're welcome to reach out. If it doesn't feel like a good fit for whatever reason related to scheduling or otherwise, I'm happy to find you a landing place and support you in that. But also, even reaching into different communities, ESI, as I mentioned, also has a listing of different professionals that can support related to loss, related to pregnancy after loss, and some of those different categories that we talked about with support. So they're a great resource even for identifying a provider.
Well, this has been so wonderful and so insightful. It's been a pleasure to meet you and have you on. Anything else you want the listeners to know before we end here?
It's hard, can be difficult to ride the waves of loss, but ultimately I hope that you know that your experience matters. You matter. For those that want that mom title, you have it. For those that want dad title, you have it. You've experienced the challenges of parenting in a very intimate way. And so just know that really is, it's a hard way to earn those titles, and yet it's yours. So I'll just leave with that.
Great. Well, thank you. Take care.
Thanks.
Thank you for listening. I hope you enjoyed today's episode. If you want to learn more or follow either of us on social media, you can find more information in the show notes. Thanks for your support and listening, and I hope you have a wonderful day.